Hello, I'm Dr. Deepak Devakar, dermatologist and hair transplant surgeon practicing at Dermasculpt Skin and Hair Clinic, Jayanagar, Bengaluru. Hair transplantation, there are different techniques. I have explained in my earlier videos about the different types of hair transplantation. I would want you to go ahead and look into those videos so you'll have more information about it. Currently, I will explain you about the best technique of hair transplantation in the world currently. So this technique is called as direct hair implant, DHI technique. DHI is international technique. It is used all over the world, and it is a more advanced FUE technique. There is minimal scarring, less pain, less bleeding, recovery is faster, and it is giving better survival of the hair compared to a normal FUE technique. So in a hair transplant surgery, there are two steps. First is the extraction of the hair, where we take out hair follicles individually from your hair from the back of the scalp. And the second step is implantation. The extraction step, we are using the appropriate size, the punch, to extract individual hairs. Everybody's hair is different. Some have curly hair, thick hair, or thin hair, soft, silky hair. Based on that, we are using imported instruments and punches which is more suitable for the scalp, which will not damage your hair roots. This is extracted, it is separated. This is the first step of the procedure. This has to be done ideally from doctor only. There are many places where technicians or different unexperienced doctors are doing. It is risky to do such, and it may cause complications. It is always safe to do the surgery completely from the doctor itself whom you have consulted. In our clinic, last 15 years we have been doing surgeries. I have done more than 2,500 surgeries. Every patient in our clinic, from the first hair to the last hair, I myself do extraction and implantation. That way we can assure you safety and results, minimal doubt. So the first step is extraction, which I have explained. Second step is implantation. Implantation in a standard FUE technique is done with slits. First, slits are made where small holes are made in your skin to small slit blades or needles. This first slitting technique itself takes around 1 to 2 hours, which is wasted when the hairs are outside your body. It is going to reduce the survival of your hair. So it is better to avoid this step. That is when the DHI technique will come into picture. Here we don't do slits. We are having imported implanters which we use, and it is a disposable instrument which is safe, and every step in this DHI is fine-tuned based on the patient which is we are doing the surgery. During implantation, these instruments are able to give natural angle and direction to the hair. The DHI technique will score over FUE technique because of this fine-tuning. The angle direction of the hair is more natural. There is no visible awkward or wrong direction of hair after transplantation. This is able to give a small natural smooth flow to your hair, and it is not identified as a transplanted hair. This is how a DHI technique is better. It is not only about the technique. It is important that with the best technique, you need an experienced and trained doctor to do the surgery. That is when you get a best result. So it is a combination of best technique plus best doctor where you can get a best result.